Subject to this PowerPoint is treating very fine red telangiectasia when you don't have access to a heat modality. Now, I've showed this technique before. However, we use this quite often in patients with very small telangiectasia. In fact, this is a patient I treated last week. So I thought it'd be interesting just to go over the technique again. In some instances, you will be unable to cannulate the small red veins for sclerotherapy, and you may not have access to heat modalities such as RF laser or IPL. So knowing this technique will allow you to treat some of these patients that have these very fine veins. Now we're just putting tumescent underneath all this complex. Nice palladium orange. Okay. Now we put tumescent underneath here. We're just going to unroof this. See, like a little micro needling. This actually just interrupts the little vessels, little telangiectasia that you can't inject very easily. And then after we do that, we'll put a little pool noodle on. This is a nice little way to do it when they're very small and it's hard to do. You can see the difference between here and here now. Now this is an easy and safe technique to use. Some patients get very good results with this. You're doing mechanical disruption and hoping the vein does not reconnect, and it usually doesn't. There's not a lot of collateral flow between these veins. The tumescent provides good hemostasis when you do the technique, which are actually destroying a vein by mechanical division. And like I said, it leads very good results. You really don't get scarring with this. So you can always do a small area and see how the patient does here back in about 2 to 4 weeks, and see what response is evident. But this is a very nice technique. We do not use it on the ankle, of course, or the anterior calf, where there's not any fatty tissue. Wherever you can use tumescent, you can do this technique. I've seen excellent results with microneedling in getting rid of some of these small red veins, especially on the face. So we've kind of adopted this technique using an 11 blade. You can also use a needle if you so desire.